Assalamualaikum and greetings everyone. We are from Group 4 which consists of Sahidah, Ain, Arina, Izati, Amiza and Nabila.
Our survival and wellness require a balance between optimism and pessimism. Undue pessimism makes life miserable. However, excessive optimism can lead to dangerously risky behaviors. Thus, optimism and pessimism are associated with two parts of cerebral hemisphere which are LH for left hemisphere and NRH for right hemisphere. The process control our optimism and pessimism was called as brain lateralization. It is the development of specialist functioning in each hemisphere of the brain or on the side of the body that is controlled. Now let's move to the functioning of LH and RH. LH is more and prone to optimistic belief which are indicate the person had high self-esteem, cheerful attitude and usually preview the situation in positive way, while RH do practice pessimistic belief where the belief is more realistic and preview the situation in negative way. The person that use more RH tendency to having lower self-esteem. So, optimism and pessimism is a trait personality. Wait, however, we can learn and develop the better personality of ourselves. Moreover, a person can be optimistic and pessimistic regarding with specific area and other aspect. Pessimism not always bad and also essential for the person. So let's understand the pros and cons of both optimism and pessimism. Optimism and pessimism is a trait personality. However, we can learn and develop the better personality of ourselves. Moreover, a person can be optimistic and pessimistic regarding with specific area and other aspect. Pessimism not always bad and also essential for the person. Let's understand the pros and cons of both optimism and pessimism. The pros for optimism is it can build resilience by looking the hardships as an opportunities, and also he holds the faith that leads to achievement in helping to face the challenges. And the cons for optimism is over optimism encourage in taking uncalculated financial risks that lead to disaster, and also overconfidence lead to negligent and reckless behavior by not being precautious and wary. How about pessimism? The pros for the pessimism is it makes the person having realistic expectations, and also pessimism can be adaptive because it alerts people to threats. However, the cons for pessimism is worrying too much about potential dangers or focusing one's energy on what might go wrong leads to avoidance behavior, passivity, exacerbation of low mood, and an increase in the vulnerability to depression. Moreover, the pessimism also can lead downplay the positive in a situation while hastening their focus on the negative as the bad consequences. Is it possible to study optimism and pessimism in an objective, methodical, and scientific manner? Yes, indeed. Although optimism and pessimism are uniquely and differentially applied in every individual's life, and despite the broadness of the subject matter, research on optimism is based on empirical and quantitative assessment. There are few instruments can be used to measure optimistic level and pessimistic level on individuals such as unrealistic optimism scale, the life orientation test, the optimism pessimism scale, the generalized expectancy for success scale, the hope scale, and also the attributional style questionnaire. After a long of talking, I will explain what is the objective of this article that my team are busy to interpret and understand. The first one is this article presents the variety of ways that this lateralization of optimism and pessimism is manifesting in the thoughts, feeling, decisions, and behaviors of healthy and unhealthy people. The second objective for the article is it thus discusses the biological origins of this laterality. So now I will introduce to you all the variety of ways that lateralized the optimism and pessimism have been manifested. First is through connective mechanism of optimism and pessimism. Optimism and pessimism are associated with distinct perceptual and cognitive modes. The principal differences are selective attention and information processing, a belief or lack thereof that one has power to influence relevant situations, events, and relationships, like locus of control. And the third one is the general schema one holds for interpreting personal events, like attribution style. The second way is the selective information processing, where the two cerebral hemispheres are differentially attuned and receptive to environmental cues. To use the common expressions, an optimist selects the positive or reinforcing cues from the environment and tends to filter and ignore information that does not match his brighter outlook. Contradict with pessimists, one allocates a disproportionately greater attention to the negative cues while tending to forget the positive aspects of a situation. To understand further, right hemisphere is more attuned to negative information. When anxious individuals watch pairs of happy and fearful faces, there was a significant attentional bias toward the fearful face when it was presented in the left visual field. In addition, individual differences in the direction and the degree of deviation can serve as a measure of hemispheric dominance. A systematic tendency to favor the left side of space indicates a dominant right hemisphere and vice versa. It has been shown that people who deviate to the right, having a dominant left hemisphere, tend to be more optimistic. Okay, how about locus of control? It is also one of manifested in brain lateralization, a general belief about one's ability or inability to control important aspects of life is a crucial element that determines a person's attitude, either in internal way, where it trusts the ability to influence their environment, or in external way, in belief the events of their lives are controlled by outside forces. Furthermore, experiments have shown that manipulating one's perception about his ability or inability to control a specific situation results in physiological, thus due to changes in the activation dynamics of the two hemispheres. So, another difference between the optimist and the pessimist is their way of interpreting important events in their lives that indicate the attribution style, which has a momentous effect on their general attitude towards the world. There are four styles that explain individual attribution based on examples given below. For the number one, the person who are prone to apply pessimism attribution always say, I am incompetent and always fail in everything I do. And the number two is the person ascribing the outcome to external, temporary, and local causes, such as the situation was very difficult and impossible, so that particular attempt was not very successful, and number one to hope for better results in the future. For the style number 3, the person success to view the event in internal, stable, and global factor where it does enhance one's good feelings and increase his or her confidence about future achievement, where the person always said like this, I am capable of succeeding in everything I used to do, enhance one's good feelings and increase his or her confidence about future achievement. And the style for number 4 is the person where the attributions of an accomplishments to external, temporary, and local causes, such as this time I got lucky, it probably would not ever happen again, where it diminishes the positive reinforcement of a success. So that's all from me. I shall pass to the next presenter.
Okay, moving to the optimism bias. It is a condition where people tend to be more optimistic than they're supposed to be. These kinds of people believe that they have low risk in experiencing negative events in the future, and they also believe that they have better chances to experience positive event compared to other people. Optimistic bias is enabled by selective information processing. This selective information processing was demonstrated in experiments where participants estimate their probabilities of experiencing whether any positive and negative event in their life. Other than that, optimistic and pessimistic attitude also can be enabled by manipulating the brain's psychological activity, which is by selectively enhance activity in one hemisphere. It was demonstrated in the experiments where participants were randomly assigned into a task that requiring them to turn their head and eyes rightwards or leftward of their body orientation. Okay, next is hypochondriasis. Hypochondriasis is a type of mental disorder where a person experiences excessive worry of having a serious illness that has not been diagnosed yet. Usually, this kind of people will interpret minor physical symptoms as signs of serious disease. Moreover, they will undertake many unnecessary medical checks and disbelieve or doubt whenever the physician said that they are okay and they are not having any serious illness. Hypochondriasis can be viewed as pessimism bias that related to health. Next is anosognosia. So anosognosia is referred to conditions where people with motor paralysis after stroke lack awareness of their deficits or simply deny it. Usually, patients with hemiplegia cannot move his paralyzed limb, but they still insist that nothing is wrong with them. Anosognosia is related to motivations. Therefore, it can be viewed as a delusion where the patients create a self-serving wishful representations of reality. Okay, for self-esteem, self-esteem refer to person's evaluations and appraisals of him or herself. It is one of the factors that can lead to someone's happiness or success in life. It is also closely linked with one basic outlook on life and the motivations to deal with challenges in life. People with high self-esteem usually tend to be more optimistic, whereas people with low self-esteem they are generally pessimistic.
Next, a person's body image is an important factor of one's self-esteem. Commonly, RH involvement in negative thinking and low self-esteem is related to their body image perception. Body image perception usually related to body integrity identity disorder (BID). This is a disorder that when a person feels that their body is inappropriate and desire to amputate their own limb, which they think it is not belong to them. Past studies have found that RH people with BID have several cortical abnormalities and majority of them have desire to remove their left limb. RH people also found tend to give harsher judgment about other people's faces and body. Thus, in this article, it's found that RH people is tend to feel dissatisfied with their body image than LH people. Other than that, for the persistent level, pessimist or RH people will usually give up quickly than optimist or LH people to achieve their goal. For example, there one experiment that need to solve some puzzles. The result of the study showed that RH stimulated group showed greater persistence in trying to solve the puzzles than RH stimulated group. Risk-taking is associated with stepping outside of one's comfort zone. In this article, it's found that optimism leads to taking more reasonable risks, whereas pessimism is associated with a lower risk tolerance. This study suggests that the LH mediates risk-taking and that the RH mediates temperance and risk-taking suppression. Besides that, depression is recognized by overly pessimistic thoughts, a negative thinking style, and a tendency to focus on what is wrong while ignoring the positive aspects of one's life. A variety of physiological and neurological studies have shown that depression is associated with a hyperactive RH and hypoactive LH. While depression is associated with hyperfunctioning of RH, mania, which is an elevated mood, euphoria, and unjustified optimism, is associated with hyperfunctioning of LH. For example, according to neurological reports, patients with LH stroke who have a relatively undamaged RH tend to be pessimistic and depressed, whereas RH stroke frequently result in euphoric and manic states. Suicide attempts, on the other hand, indicate the ultimate pessimistic and hopeless state. An EEG comparison of healthy girls and those who attempted but did not commit suicide, for example, discovered increased physiological activity in the RH in the suicide attempter group. Furthermore, suicidal patient had a larger right amygdala than non-suicidal patient. As a result of these findings, pessimistic moods is strongly linked to RH at both the physiological and anatomical levels.
Assalamualaikum and hi, I am Nabila and now I will discuss about the pessimistic thoughts are stained with fear and stress. According to a number of studies, the RH mediates a more fearful and watchful mood than the LH. This mental stage appears to be the major factor to the association between the RH and pessimistic thought patterns. Moving on to the process of pessimistic thoughts, the peripheral autonomic nervous system, which regulates heart rate, blood pressure, respiration, digestion, and sexual arousal, controls visceral functions via two branches, which are the sympathetic and parasympathetic nervous system. The SNS gets the body ready to respond to a potential threat or danger by increasing heartbeats in order to accelerate blood supply to the motor organs. It also increases sweating to keep the body temperature within an optimal range, tightens the blood vessels of the gastrointestinal tract, which slows digestion and saves energy. Then, after the threat has passed and a potential fight or flight reaction is no longer necessary, the PSNS, which functions as a safety mechanism for the SNS effects, will restore physiological regularity and calmness. This is achieved through the PSNS reversal of the SNS actions through slows the heartbeats and respiration rate back to normal levels, expands the gastrointestinal blood vessels to facilitate the digestion process, and stops the sweating. According to the studies, anatomy, physiology, and neurology data indicate that the RH is crucial in mediating SNS processes, whereas the LH is primarily linked to the PSNS. That is why RH is biologically designed to handle potential threats compared to LH. When presented in the LFV, left visual field, most frightening stimuli are more easily identified and produce a stronger skin conductivity reaction, such as sweating. It is controlled by the sympathetic nervous system, and skin conductance is an indication of psychological or physiological arousal. If the sympathetic branch of the autonomic nervous system is highly aroused, then sweat gland activity also increases, which in turn increases skin conductance. This situation is initially processed in RH. Another example is that people who are scared of cockroaches detect them in their LVF faster than RVF. Additionally, when experiencing negative emotional stimuli, the stutter reflex may be activated. The LH primary function is to maintain relaxation, whereas the RH serves as the alarm system to identify potential threats and prepare the body. In short, pessimism is a thinking style that expects negative outcomes in the future. They focus on what might go wrong rather than on what is good. Next, I will explain about optimism is interlinked with a proactive attitude according to my understanding. Jeffrey Grace proposed that our interaction with the environment is controlled by two neural systems, the Behavioral Activation System (BAS) and the Behavioral Inhibition System (BIS). As you can see in the slide, BAS and BIS are hemispherically lateralized in the brain. Left hemisphere is primarily associated with motivating one to act and approach positive stimuli. Meanwhile, right hemisphere involved in avoiding dangers and inhibiting actions that may lead to painful consequences. The BAS regulates appetitive, positive incentive emotion, while BAS is basically regulates withdrawal or avoidance. For example, a commitment to do the task is associated with an increased left frontal activation, stimulation and action mode, or receival result on something will put individual in an active mood for defending their good reputations. The LH mediates an active mood for achieving one's goal, which is reflected in the motor or behavioral, emotional and cognitive domains. Optimistic people tend to have different coping mechanisms or strategies than those who are pessimistic. The optimistic thoughts stimulate proactive coping mechanism and keep trying even when things are difficult. The satisfying outcomes foster the feelings of self-efficacy and environmental mastery, which is internal locus of control, which supports the proactive mindset. For example, athletes and people who are highly active were found to be significantly more optimistic than inactive or low active people in comparisons among healthy people. According to experimental studies, there is an increase in neural activity in several LH regions or a decrease in RH activation during active physical exercise. As a conclusion, there is a link between high levels of physical activity and a LH dominance.
Thank you. Let's proceed to the next point, which is the dexterity breeds confidence. Dexterity breeds confidence is basically about the skill to perform tasks. In this article, it stated that an individual who have the dexterity breeds confidence will get from our left hemisphere brain and right hemisphere brain. Pessimistic schema is largely linked to our incorporate into neural circuits and networks in the right hemisphere brain, whereas optimistic schema is structured and assimilated into the neural structure and system inside the left hemisphere brain. Right hemisphere brain is basically the sensation of a insecurity of a watchful and hypnotist mode that leads and encourages gloomy patterns, whereas left hemisphere brain is the active mode and the positive feedback that received from our motor skill. When we feel that dexterity breeds confidence in our life, it will link to our action. From the action, of course, we do the schema, which is we call them plan. Schema is about the organized pattern of reasoning, emotion and behavior, which is representation of a plan. Example given in the article, which is an infant instinct to sucking is already present from the birth. This action is called the repeated since it meets the baby basic needs. The infant basically begin to sucking everything. When they gains the ability to differentiate between the eatable and non-eatable objects, it realizes that the certain object do not satisfy when they suck. From a cognitive standpoint, the baby is attempting to integrate new experience with its previous knowledge that sucking produces satisfaction, and through the interaction with the object, it contradicts this expectation. So, the schema is changed. So, likely it basically that the infant is planned to suck everything in the beginning, but after they know and after they differentiate between the eatable and non-eatable, the infant will get the new experience and knowledge to get their satisfaction. In this article also stated that 90% people is more dexterous in the right hand. Example, they will perform the motor skill better with their right hand than with their left hand. So, what happens if they use the right hand and left hand? Why this is linked to our brain? Basically, the left hemisphere brain is control the right hand, and compared to the right hemisphere brain parts, the left hemisphere motor regions have a greater neural connection. Next point is the perfectionism. Perfectionism is defined of the unacceptance of the need for satisfaction in some parts of life, which is it ultimately leads to even more disappointed with one imperfect existential condition and personal flaws. How can this happen? This is basically because we are too much concentration on the imperfection of one's surroundings and circumstances. When the mentality is absorbed in the sense of the idea that I'm not good enough, this can inspire us to become the desire for perfectionism, self-improvement and personal growth. In this article also stated that perfectionism is also occur because of neurobiological perspective. This is because schema of pessimism is recorded into the psychological activity of neural networks within the right hemisphere brain. This is when the condition in which the right hemisphere brain has the relatively leading the role in detecting the mental experience. So, when the perfectionism occurs into our right hemisphere brain, it receives a relatively poor motor skill feedback and overall sense of clumsiness or awkwardness. It mediates the negative thought pattern like we could have the low self-esteem, depression and pessimism, and it could lead to become more sensitive person in life. Next, the example given from this article, when pessimism occurs, the left hemisphere brain provides the right hemisphere brain with a temporary advantage to activate the pessimistic schema, which occurs a set of behavior.
Okay, next is the second article, Hope and Optimism as an Opportunity to Improve the Positive Mental Health Demand. Positive psychology studies adaptation to adversity and aims to identify factors that favor good psychological adjustment as well as physical and mental health. Suffering is an inherent part of life that must be confronted rather than avoided or amended. Positive mental health encompasses the personal resources to face life's challenges, foster satisfactory relationships with others, and achieve psychological well-being, including feelings of satisfaction with life, vitality and energy, and physical well-being. Hope and optimism, although often used interchangeably in clinical discourse, are in fact distinct constructs corresponding to a distinct mechanism by which expectations shape human behavior and produce positive outcomes. This opinion paper aims to examine some differences between optimism and hope and integrate these constructs in the context of positive mental health. We also intend to point out some interventions that promote hope and optimism, where mental and psychiatric health nursing play an important role. Benefits of optimism and hope for positive mental health. Optimism is defined as a cognitive variable reflecting one's favorable view about their future. The benefits of optimism is generally have more positive than negative expectation and tend to report less distress in their daily lives even in the face of challenges. What is expected to happen in the future can affect how people experience situations in their daily lives, their health, and how they deal with emotions and stress. Optimists are more focused on generalized expectation rather than how or why the goal is achieved. Optimism is related to fewer symptoms of depression, higher level of well-being, lower attrition rates, and stronger perceptions of social support. The positive repercussions of optimism may be related to the greater probability of adopting health-promoting behaviors and coping strategies that enable better psychic adjustment. Optimism is modifiable and associated with better cardiovascular health and increased likelihood of healthy aging. Pessimists have a less favorable perception of the world and are more likely to adopt risky behaviors such as the use and abuse of alcohol and other drugs, and display more harmful reactions and adaptation to adversities compared to optimists. Okay, next is hope. Hope is a state of positive motivation based on three components: objectives, goal to be achieved, second is pathways, planning to achieve these goals, and third is agency, motivation directed towards these objectives. Hope theory emphasizes the presence of personal agency related to goal and the recognition of strategies to achieve these goals. For the benefit, according to recent research, an individual's level of hope is often determined by innate personality characteristics and influenced by psychosocial conditions, success in attaining goals and facing stresses, social support, goal concordant care. Second is physiological factors, including stress hormones, immune mediators and neurotransmitters, and environmental factors. Hearst's model of hope assumed that hope is a cognitive and motivational attribute needed to initiate and support actions toward goal achievement. As a catalyst for positive change, hope promotes overall mental health and may help heal specific conditions, including severe mental illness, suicidal ideation, depression, anxiety, and trauma-related disorder. Research also demonstrates that hope promotes well-being more than optimism or self-efficacy. Self-efficacy is individuals' belief in their own ability, perform tasks, and attain goals. Research shows that hope has strong association with several psychosocial processes and outcomes, including positive affect, emotional adjustment, and illness-related coping, greater life satisfaction, enhanced perception that life is meaningful, a higher sense of purpose in life, quality of life, and social support. A greater sense of hope was associated with better physical health and health behavior outcomes, example, reduced risk of all-cause mortality, fewer chronic conditions, and fewer sleep problems. Higher psychological well-being, example, increased positive affect, life satisfaction and purpose in life, and lastly, lower psychological distress and better social well-being. Okay, last but not least, strategies that promote hope and optimism in psychiatric mental health nursing. There are 8 strategies to cultivate a hope and optimism mindset. First is emphasize on strengths. Identifying and exploring individual strengths foster a sense of hope and resilience. Bonding with others is one of our strengths, thus reaching out to friends and loved ones can create hope and positive emotions. Next is reframe negative thought. When a person feels anxious or desperate, focusing on what is scary and seeing in a positive way can bring an immediate sense of pleasure and pride in themselves. Next is practice hopeful thinking. A focus on hopeful thinking as an intervention, enabling individual to re-engage in pleasant activity and improve self-talk. Hopeful thinkers take intentional action to achieve a desired outcome. Practice of hopeful thinking involves the perceived capacity to envision workable routes together with the energy towards goal attainment. Next is increasing self-esteem and self-awareness. Mindfulness-based intervention, including activities like sensory awareness, guided meditation, breath control, foster happiness and self-awareness. When a person feels optimistic and hopeful, they often view themselves as benefiting from another person's generosity, leading them to feel valued. This increased self-esteem, which in turn leads to higher level of psychological well-being. Next is hang out with hopeful and optimistic people. Surrounding ourselves with hopeful and positive people can, by emotional contagion, lead us feel that way ourselves. Evidence reveals that both positive and negative emotions are contagious, so we need to choose our social environment and interactions. Practice gratitude. Simple gratitude practice like journaling, self-compliments, or sending thank you notes can bring sanctity and authentic happiness and be more effective than self-control, patience, or forgiveness in generating hope for the future. Next is reinforcing positive effect. Induce positive effect by several different means, such as viewing a comedy film, receiving a gift, facilitates flourishing, and predicts subjective well-being. Hope is related with positive affect and inversely with negative affect. Positive emotions are particularly important to mental health in the context of high stress. Last but not least is training resilience and finding a sense of purpose. Resilience refers to the ability to recover quickly from adverse events and experience. Resilient people tend to maintain a more positive outlook and cope with stress more effectively. Facing crisis can be strengthened by finding a sense of purpose in life. This might implicate involvement in the community, cultivating spirituality, or participating in meaningful activities. That's all from our group. Thank you.